thank you all for coming out this afternoon. I really do appreciate it. We're going to talk about a very important topic right now, and this is the Mayor's Community Task Force on Policing. As everyone knows, with the murder of George Floyd, that brought a great deal of anger and frustration to the surface across the nation and here in our city as well. As you also are aware, I'm not one to make quick decisions that are not grounded in fact. And so what I wanted to do before addressing some of these issues that were brought to our attention was to ensure that we heard the community's voice. And I didn't want to just placate that anger and frustration by making decisions that only had a temporary effect. I wanted to ensure that decisions were based on thorough, thoughtful reasoning and were in fact evidence-based and would be have positive results for everyone in our community. So to that end, we brought together the Mayor's Task Force on Policing, and we had a very diverse cross-section of our community. We actually had 50 individuals that were comprised of community leaders, educators, community activists, clergy, and police officers who all came together to have very difficult conversations and to really bring together what the community wanted to see in their police department. Many of you hear me talk about Sir Robert Peel's principles of policing. These were written back in the 1800s, and they actually hold true today. And one of them says that the police are the community and the community are the police. It also says that law enforcement derives their power through community trust. Without the trust of the residents, in effect, law enforcement are powerless to go out and control crime and disorder in the community. And so, again, it was incredibly important that we had the community's input on this. So as an objective oversight, we called and asked Dr. Stephen Carell if USF would participate. And he agreed immediately. And so we were able to get Dr. Bryanna Fox and her graduate students who also participated in these sessions. They recorded all of the conversations, they digested those down, they surveyed all of the participants, and in essence came up with 17 findings. And these findings were couched within the 21st century task force on policing that many of you may recall from some years back. And those, in essence, the pillars deal with trust and legitimacy. They deal with policy and oversight, technology, social media, communication, and community policing. And so these findings, in essence, were couched within those particular pillars. So again, very happy with the outcome of this, very excited about moving forward with the implementation of these findings and recommendations. And so I would like to have Chief Dugan, first we're going to have Dr. Bryanna Fox come up, and she's going to talk about the findings specifically and the surveys that were taken and actually the entire process that was involved. And then we'll have Chief Dugan come up and talk about some of the initiatives that they have already developed based on these conversations. So Dr. Fox?
Thank you so much, Mayor Castor. And thank you all for being here and covering this. I've done a lot of work with police departments and communities around the country, and I was really actually pleasantly surprised because this is not something you see every day in terms of putting together a community task force to hear their thoughts, inputs, to get research on how the community is feeling, and then to actually implement evidence-based policies and programs to address those concerns. So this was a academic stream, if you will, but for me as a community member, it was also incredibly beneficial and important. So as Mayor Castor mentioned, my graduate students and I listened to everything that the community members were saying regarding those 5 pillars from the 21st Century Policing Guidelines. We also implemented surveys with the community members that were on this task force, because we wanted to see, compared to other areas and other people, how did they rate their perceptions of Tampa Police Department, and get a very empirical, quantitative number on that. From all of this information, we were able to process it and look at what are the general themes we're seeing in terms of concerns, areas for improvement, things that the community would like to see in their police department. And based upon that, we came up with these 17 findings. But I would note that those 17 findings were not my ideas. They were really things that have been tested before in other agencies. They have been things that have been shown to be effective. I was not willing to take, a new untested idea and say Tampa is going to be the, guinea pig for this. We wanted to make sure it was something that was shown to work through prior research and evaluations, and that they had the desired effect on the outcomes that we were interested in. So for all 17 of our findings, that was what we had suggested. I was very pleased this morning to hear that already 2 of the 17 findings have already been implemented, already been done. So I think that was incredibly important, and really just shows through action what we can expect in terms of future process in terms of our evaluation and our findings. But there are 15 more, and the mayor has asked that I participate in an oversight and evaluation capacity. So for me, that's incredibly important, because again, it just reinforces that this is long-term. This is for our community, it's for our department, and it's also for research and evaluation, making sure it's working the way we think it is and the way it should be. So thank you, Mayor Castor, and thank you, Chief Dugan, for putting those into play this morning already. That was fast, even for academic standards. That was incredibly fast. So thank you, and I believe now turning over to Chief Dugan, Mayor?
Yes.
Okay, thank you.
So I'd like to thank Mayor Castor for her leadership and Dr. Fox for her input. Some of the things that we are going to be working on, one of the pillars talked about reinstituting a community policing model. So we'll be updating our performance matrix to capture foot patrols and encourage public interaction. So what does that mean? Is now when officers, as we track their activity and what they're doing out there on the street, they will specifically have to put themselves out on their foot patrols, and we will capture how much of that we are actually doing. And then on September 20th, this month, we'll put 40 officers back into districts with a focus on community policing and violent crime. We're reorganizing some of our people. They'll still be on the same task, but they'll report in the neighborhoods themselves, and they will stay out there, and they will be focusing on community policing and violent crime. One of the other initiatives that we have working on, that we're going to do ICAT training, which stands for Integrating Communications, Assessment, and Tactics. ICAT training is something that is put on by the Police Executive Research Forum. It's a police think tank. And this is a training guide for diffusing critical incidents. And what it comes down to is it teaches our officers to focus on de-escalating a situation, slowing down, and continually reassess the situation. I've also been in contact with Chief Dan Slaughter of Clearwater and Chief Tony Holloway of St. Pete, and the 3 of us are going to partner in bringing ICAT training to the 3 largest police agencies in the Tampa Bay area. And that's something I'm very excited about, because when you look at many of the events that are happening, that is spurring so much controversy, these are incidents that could probably be de-escalated, and we are going to put a focus on our training to de-escalate every situation. Another part of our training that we're looking at doing, we're going to partner with the NAACP and other members of our community to develop a curriculum to teach officers about the history of policing, history of policing in particular Tampa, and what has gone on, so that our officers have a better understanding of the history of officers not in our department and things that have happened in our community, so we will know better how we are perceived and how we can do better. And then our last thing that we are going to immediately put in, that we're looking at putting into place, is a mental health response. That has been big from the task force, and we are going to be doing a request for information, or there's also an RFI. There's all these acronyms that purchasing gets into, request for application. And really what it's going to come down to is we want to find mental health experts, help us build out a program that can help us when we respond to people that are having a mental health crisis. Initially, what we are going to use is potentially 2 analysts that will help identify the people that we come in contact with the most and those that are in critical needs. And we'll help develop a program to check up on them, to make sure that they're following their care. And the idea is to continuously assist them so that we don't have to interact with them when they hit a crisis. But that is down the road. That is something that we're going to work on. We're going to partner with mental health experts. You know, that is the vision, but we're going to need the mental health experts to kind of help us, guide us in how we can get there. 2 of the updated policies that we've done this morning in response to the task force is that, you know, there's a no-knock search warrants controversy, obviously because of Bryanna Taylor. Now, that is not something that we do as a practice here at the Tampa Police Department, but what we have done is added language to our policies that will reflect this request, that it will require a judge and the chief of police to approve that. You know, it's not something that we normally do, but I felt if the task force felt that that needed to be part of our policies, I had no problem adding that language. The other one is when we have our response to resistance, which is more commonly known as use of force. We've added wording there that every officer is required to de-escalate the situation when possible. And so what the goal is to have our practices reflect our policies. Mayor?
All right. Thank you, Dr. Fox, and thank you, Chief Dugan. Very, very important issue for us, critically important. And it was very interesting to participate in some of these sessions with the community. And I talked earlier about one of the pillars with communication, with transparency, and some of the feedback that was received. Quite often, the participants would say, well, I think the police department should do this, only to hear, well, we do that, we've been doing that. So you can never over communicate or be too transparent with the residents in our city, especially when it comes to law enforcement. Very, very important. Again, I want to thank our residents that took their time, gave of their time, energy, and expertise to participate in this task force. It was very meaningful, I know, for law enforcement, very meaningful for the participants as well. As was stated earlier, we had a discussion with the participants this morning to talk about not only the steps that the Tampa Police Department are taking that were just outlined by the chief, but also to talk about having this group continue on to participate in the oversight. You know, the answers to a problem are just part of the equation. It's in the successful implementation of those equations that we are going to be a better community. And so what we have done is asked Dr. Bryanna Fox and her students to stay on and to provide oversight to ensure that all of these findings are successfully implemented in the Tampa Police Department. Now, Dr. Fox was kind enough in her graduate group to assist us in the beginning at no cost. But to continue on in the next months and possibly up to a year, there's going to be a financial requirement associated with that. And as is one of the wonderful things about our community is whenever there's a need, individuals and businesses step up. So in this particular instance, as social justice is an issue that all of our sports teams are very, very concerned about, very involved with, and want to improve in our community, they have all stepped up. The Bucks, the Lightning, and the Rays have all stepped up to provide the assistance so that Dr. Fox and her team can continue. I've also asked every member of the task force to stay involved as well. We plan quarterly meetings to provide updates, but I've asked them to, if they provide daily, if not weekly, input, suggestions, whatever it is that they can help guide towards the successful implementation of these findings, we've asked them for that. So we're very, very excited about these findings and how they're going to improve the relationship between our residents and the Tampa Police Department, because ultimately the residents and the officers have to work hand in hand in order to keep our community safe. You've heard me say it many, many times. Tampa is one of the safest cities in the nation for our size. And that really is the foundation on which we are going to grow as a prosperous city. Businesses aren't going to relocate here. Families aren't going to relocate here if they don't see Tampa as a safe place to bring their families. And so I'm very proud of what the task force has accomplished. I'm also very, very proud of the men and women of the Tampa Police Department and what they do every day to keep all of our citizens safe. Now, there's a great deal of division in our country today. You can see it, you turn on the television, and it's not on for a couple of minutes that you don't see some type of divisive wording or actions that are taking place across the nation. And that cannot happen in our city. We are a very diverse, very close-knit community that celebrates our diversity and that works together to solve our problems. And this is another example of why Tampa is the greatest city in the nation, because we come together to solve our problems and lift our community up. So I couldn't be more thankful for the actions of the task force, of Dr. Fox, and of the police department as well. So at this point, we will open it up to any questions anybody has, and everybody's available. If I can't answer the question, then clearly it goes to Chief Dugan. So they're already on our website. They actually were on the website as of Saturday, was when Saturday morning we had a 3-hour session where Dr. Fox presented the findings to the task force. And after that was done, I believe there's a recording of the entire session, correct? That's up on the city's website. So you'll be able to see all 17 of those. Let me give you an example of one of the suggestions that came from the community. One of the things that we talked about was ride-alongs with officers in your neighborhood to find out what the officers do every day. And one of the suggestions was, how about a reverse ride-along? How about the police officer rides along with a resident to see the neighborhood from the resident's point of view? And what a great idea that is. And that's just one of many suggestions that came out of the task force, and the findings are on the website. Yes, well, some of them are already in place, you know, as the chief had mentioned. Some of them are very policy changes or things that can be done very quickly. But when you look at the mental health, you know, dealing with mental health, a lot of the social issues that we ask our officers to go out and handle: homelessness, addiction, mental health, domestic violence, those types of things that could be better handled by individuals that are trained in those particular areas, will take a little bit longer. But the police department has made advances. All of the officers are trained in critical intervention techniques or training, but they have a group of officers that receive extensive training, and then they are available. That training is indicated on the rosters, and so if a call comes in dealing with someone who's in mental health crisis, they'll send an officer that has that additional training if they're available. But it would still be better handled by a mental health professional. Those will take a little longer. The task force seemed what? More wealthy? Ooh, well, I don't know what task force you were looking at. We had invitations to every one of the activist groups that have been demonstrating throughout the city. We had members of Black Lives Matter and several other groups. I don't have the names of those. We had clergy on there. We had individuals that from the Hispanic community, from African American, from the Black community, from LGBT. So we had a very diverse cross section of our community. It's difficult. You have 400,000 citizens, and to bring 50 individuals together and say that is completely inclusive, and that the findings from that group are representative of 400,000 people is difficult to say. But I feel very confident that we had very diverse opinions in that. And that meeting was, all of those meetings, the information is available on the website, and we welcome any comments, any opinions, any suggestions from anyone in the community.
When you talk about the oversight in the task force moving forward, what shape does that oversight take, and how will it specifically be encountered?
Well, I'll let Dr. Fox talk to that because she's the academic, but we just wanted to ensure that we had that objectivity and that assurance that this wasn't an exercise, that we didn't say we're going to check a box and move on, that we listened and we heard, and that we are going to implement these findings that will not only improve the Tampa Police Department, but improve that relationship between the residents. Dr. Fox?
Well, great question. Devil's in the details. So we've been just thinking about this since Saturday, what the next phase will look like in terms of oversight. It will be things such as, me coming into the Tampa Police Department, meeting with people, asking what's been happening, since our last meeting, going on ride-alongs, seeing if officers are doing the things that we're talking about in the training, in the spirit of our recommendations and findings. But other things in terms of measuring the actual impact. And that's oversight as well. It's not just the qualitative portion. It's the actual, did it make an impact the way we expected? So I think through those different means, and that's why it's such a time-intensive and really intense process, making sure through all these different avenues that we're seeing, is it working the way we thought it would, and is it happening the way we thought it would?
Yeah, I'm pretty confident it's going to work because we're committed to this, and we're going to be out there. We're going to rethink the way we're doing things because clearly people aren't happy, and we have to change. We can't continue to do the same things and expect different results. And there's going to be accountability. We're going to put the stuff on the website. We have Dr. Fox. She's being paid by outsiders, so it's completely, objective, and we're going to be held accountable. We're going to hold ourselves accountable, and as we accomplish each of these tasks, we're going to show it on our website. And if for some reason we can't accomplish something, Dr. Fox will be involved, and there will be accountability.